number 4, we are into resources. As far as resources is concerned, as usual, we will break them down into learning-oriented resources, exam-oriented resources. As far as learning-oriented resources are concerned, there are 3 major learning-oriented resources. Number 1, books. Number 2, your school. And number 3, online platforms. As far as books are concerned, number 1, pathology. Pathology gold standard learning-oriented books is Robbins textbook of pathology, basics of diseases. Now, Robbins comes in 3 formats: big Robbins, medium Robbins, and pocket Robbins. Don't go for pocket Robbins if you are looking for a learning oriented resource. Rather, you can choose big Robbins or mid Robbins. Mid Robbins is a go-to and most recommended book for undergraduate students, but you can study big Robbins. I actually studied from big Robbins. So that is a very good book. We'll discuss books in details in some other video, but just for the sake of overview, this is for pathology learning oriented resource. Second book is Harsh Mohan. That is also a pathology book, and there are a few Indian books, other Indian books also for pathology. But Robbins is the most talked about book as far as pathology is concerned. Number 2, microbiology. Microbiology, the most talked about book is Levinson. I studied from Levinson. That is a review book, but that is not just little review book. That is essentially a thick review book that is both learning oriented and exam oriented resource. Then comes Greenwood microbiology and Jacqueries microbiology, but Levinson is the most talked about learning oriented resource as well as microbiology is concerned. So this goes with the pathology basket. Now, number 3, we have pharmacology. As far as pharmacology is concerned, there are a lot of learning oriented resources. This you should remember that you have not to study all of these resources. You have to choose one resource based on your taste. My job here is to orient you and make you aware that these resources are out there, which are most talked about, most used resources, and you can choose depending on your taste the resource you want. So we were into pharmacology. Pharmacology, the Bible of pharmacology, Goodman Gilman, and that is not much recommended for undergraduate students, but you can study it if your taste fits in. Then comes Katzung. Katzung again is big Katzung and mini Katzung. Big Katzung is a very big book, thick book, and mini Katzung, though its name is mini, but it's not so mini. It is also essentially a good both learning oriented and exam oriented book. So you can use any one of them or both of them in conjunction. It is recommended that you use them in conjunction, but we'll discuss later that how to tackle pharmacology as a subject. So this is, and then of course, not to forget Lippincott as a learning oriented resource. That is also a review resource, but both review and a learning oriented resource, it can be used as well. So this is essentially about pharmacology. Then forensic medicine, there are a lot of options again for forensic medicine. There are a lot of Indian books such as Parekh, Krishan Vij, and other Indian books. At our institute, we are recommended to use Parekh and a Pakistani book, that is Nasibar Awan for Pakistani law and Parekh for other aspects of forensic medicine. And there is another book if you want a single book for law and all aspects of forensic medicine, that is Shahbaz, a Pakistani book. But beware that when you are using Pakistani books, there are a lot of discrepancies and mistakes that need to be taken under consideration. So this is about the books of forensic medicine. Another resource of forensic medicine is online website for Pakistani law, from where you can consult different sections of law regarding different aspects of forensic medicine. So that is another online platform resource which you can choose for your learning oriented study. So this is about forensic medicine, learning oriented resources. Then comes community medicine. As I said, we won't discuss community medicine in detail, just naming the resources. The gold standard is Park's textbook of community medicine. In Pakistani books, There is Ilyas, of course, with mistakes. Then there is a public health book published by King Edward's Medical University that can also be used. So these are learning oriented resources for community medicine. Then vertically integrated subjects, you can use any of the books of medicine and surgery and allied subjects. But essentially, at this level, at third year MBBS, if you take your lectures at your institute and you are taking notes and you are attending your wards regularly, I think that will be enough. And if you are studying your basics regularly and your basics are very strong, then that will be enough for you to ace your vertically integrated subjects at third year level. So this was about the books. Second, your school. Well, in third year MBBS, you start to attend your wards officially, and there is a dedicated times for you to visit your wards. So I recommend that don't miss this opportunity. You have to go to wards because this is ultimately what you are going to do. Go to your wards, learning about the basics of history taking, general physical examination. This will be the major focus of your wards in third year MBBS. This is very important because that is the essence and central pillar of clinical medicine, history taking and examination. So this you will start learning in third year MBBS, and you will get more and more oriented, and your mind will get more broadened as you go to the wards regularly. The more you sweat in peace, the less you bleed in war. Simple as that. So clinical medicine is very important. We'll discuss it in some other video. And of course, your discussions and your class lectures and your routine, that all matters many a little maximically. So this is second learning oriented resource, your medical school. Third is online platforms. As far as learning oriented resources concerned, I have told you multiple times that there are very few learning oriented resources online, many exam oriented resources though. But if I, and I'm also not very big fan of online resources, that we'll discuss later. But here, if you want me to talk about online resources, I would tell Dr. Najib lectures is one of the go-to resources for learning oriented study. Otherwise, I don't think that many online lectures can help you in going for the learning oriented study as I perceive it. So this is about the learning oriented part. Now we go to the exam oriented study resources. Again, number one, books. Number two, your lectures. And number three, your own notes. Lectures, by lectures, I mean online platforms. But as far as books are concerned, number one, pathology. The gold standard review resource for pathology is Pathoma by Hussain A. Sattar. And Pathoma, you can study with Pathoma lectures, and it is more than enough if you are studying a learning oriented resource alone for your review. Then is first aid, and then of course Kaplan lectures and BNB and what not. There are many review resources for pathology, but gold standard is Pathoma. Then for pharmacology, as I told you, Minicats and Lipin Code, they can work as both exam oriented and learning oriented resources. And then there are Indian books, Tara. There are other Pakistani books, but you can use them in conjunction with your primary learning oriented resource, but not as a primary resource because there are many deficiencies. And as far as pharmacology is concerned, you will always see something in exam which you have never came across. So make it as strong as you can. So this is about pharmacology. And as far as in pathology, the second part, microbiology. For microbiology and pharmacology both, there is a series, online series, that is sketchy series. There are pictures and mnemonics which you can use. I didn't use it, but that is very talked about resource about learning microbiology and pharmacology. You can try it. If it fits your taste, then you may use it in conjunction with your primary resources. And Faiz Kharoti is a small book, and there are many notes, of course, for microbiology which you can use uh, for review. And for pharmacology, I've already told you. And for forensic medicine, same books I discussed in learning oriented resources, you can study in exam oriented resources. There are other books like Jamiyat, book by Jamiyat Amir Salim. They are short, but there are many mistakes, so you need to keep them under consideration. But you can use them, of course. And as far as community medicine is concerned, before modular system, Excel community medicine was very talked about resource, learning oriented, exam oriented resource. But now with the modular system, that does not cover all of our topics. So there is a new book that is Hayat Community Medicine. I haven't studied that as a whole, but I know that it contains most of the topics of your modular system, and you can use it in third year and fourth year for exam oriented study, of course. And there is a rapid review of community medicine, and there are other notes as far as learning oriented resources concerned. Well, this was a community medicine, and then of course, your vertically integrated subjects, you can use whatever resource you want. Your class notes, your lectures will be more than enough with your basics strong. And then comes our online platforms that I've already discussed with the books in online platform for pathology, Pathoma, BNB, Kaplan. They are also online platforms, and same goes for pharmacology and microbiology. And for forensic medicine, I haven't used any online platform, but there are Indian platforms, and of course Indian platforms like PrepLadder and Marrow, and YouTube platforms like Ninja Nerd. All of them can be used in conjunction for learning, for exam oriented study, as far as online platforms are concerned. So you can try them and see what fits best to your taste. Here my purpose is to make you aware, and you have to decide yourselves, because if we have one-to-one conversation, then of course I can know what type of person you are and what you need and how to turn you towards the right path. But in a video where you are watching me without direct contact, I can just give you a general overview. So this is about the learning oriented resources. And third of two learning oriented resources we have discussed: number one, review books; number two, online resources; and number three, notes. I have always emphasized that if you are making a learning oriented resource, make your own notes. That is very essential, because I'm repeating it, but it's worth repeating, because your conscious mind is bridged to your subconscious mind by writing, and your short-term memory easily goes into long-term memory. So writing your own notes is the best learning oriented resource there can be. So this is essentially about the resources. Now the fifth part of our video, where I talk about an example how to integrate this one learning oriented resource and one exam oriented resource for effective output. In first year, I discussed physiology. In second year, I discussed biochemistry. In third year, I'll be discussing pathology, because these are sort of prototype subjects which I'm targeting. How I integrated pathology learning oriented resource with exam oriented resource. For learning oriented resource, I picked this Big Robins. You might be seeing it. Here it is. So I picked Big Robins for learning oriented resource. For exam oriented resource, I picked Pathoma. Now, I think I was maybe the only student in my class who was using Big Robins, because most of the students use Mid Robins, and that is the recommended book. I don't regret studying Big Robins, but it was hectic, of course. So you can choose any book, Big Robins or Mid Robins, and of course you will forget it, because this is, you cannot retain this thick book. For that, I chose Pathoma for the purpose of retention. What I did that I studied from Big Robbins. Then I came to Pathoma. I also watched Sir Hussain Sattar's lectures with Pathoma because just studying bullets from Pathoma without lectures doesn't make a complete sense. So, what I studied from the big book and what I felt was deficient in this small book, I annotated those things from big book on this small book. And by the end of year, I had this 200 pages book for pathology condensed from this big Robbins and pathology review itself into a exam oriented resource, and I just had to read, review and recall that resource. So this is how I integrated both of these resources. So I didn't miss upon learning, and I also got better at exams by the grace of Almighty Allah, of course. So this was an example of how to integrate a learning oriented resource with exam oriented resource. Well, with this, we come to the conclusion of this video. I have discussed this video in 5 domains. Number 1, 5 general considerations. Number 2, subjects. Number 3, blocks and modules. Number 4, resources. Number 5, an example. If you have any questions, you can ask us and approach our media manager on our social media platforms, Instagram, Facebook, YouTube. We also have a web page. All the links are mentioned in our bio of this channel, and we'll be happy to hear it from you. Thank you very much and good luck.